the weekly government press briefing when it comes to you live from the Miata Civic Center. It's exactly 2 o'clock here, and we usual press conference to you. Mina Mohammed Jawad, Strategic Communications Advisor and the Minister of Information and Civic Education. And as usual, we press conference now for inform and educate Sierra Leoneans and give them updates about the major things we do in government. Today we get a very, very big conversation here in our press briefing. We will talk about the preparedness of the healthcare system for the different global threats that we get currently in the world. So today we get forget a very, very big conversation for let una know waiting una self for do, but waiting the healthcare system as well and Salon de Pandu as well for make sure say we are ready. But as usual, we start with weekly updates on some of the major things that will happen across government. And one of the major thing is that last week Friday, President Julius Maada Bio been in UK and a very compelling presidential lecture at the Africa Together conference at the University of Cambridge, which I call on African nations for embrace strategic leadership, institutional resilience, and bold decision making in the era of the global disruption we will get. The theme of his speech been really focused on Africa in the age of disruption, and it been put forward the case for let Africa work together in the midst of the difficult global circumstance now where the continent defend himself. It won't say Africa in greatest risk, not only disruption but entering an age without strategic agency. That speech has now been applauded as one of the best speeches so far regarding the elements that we highlight as the leader, as one of the emerging leaders in the continent. Chief Minister Dr. David Moynihan Sende alongside the Minister of Energy this week as well been visit the Nant power plant for see how far that work they go. The $417 million project, when it done, it will generate 108.4 megawatts of electricity, which means effective as at that time it would put we challenges of energy behind me. Of course, he was impressed by the level of work we see and how far it don't go, and it's a project where governments they pay keen attention to for make sure say we resolve the difficulties in the energy sector. Last week as well, residents of Lunge expressed their excitement when finally government don't decide for make Lunge as a city. Lunge is one of the several locations across the country will get for be affected by the redistricting, and for sake of that, government meeting at Lunge last week for engaging the people of Lunge through a civic town hall, also the Minister of Local Government and other top government dignitaries as well been present for tell them about the different opportunities where that particular decision therefore bring for the people of Lunge. Last week as well, about 2,626 Sierra Leone Hajj pilgrim them as well. They've been finally left the shores of Salon and they don't arrive safely in Saudi Arabia for the Hajj pilgrimage. And all of them they out today and then they observe the day of Arafah. So we pray that the prayers and that blessing they as well go cover me. 1,800 of them are pilgrims from the diaspora and 826 of them are pilgrims from Salon. So that the major updates that we get as last week. Of course, last week as well, another major update as well was the mining conference as well. We wrap up and the Vice President been give a resounding speech about the way forward for mineral governance in Salon and also generally in Africa. And I want to go to my panel because, like I said, today we have a star-studded panel. People they take care of we all well in this country, and they will be in the panel today with me. And I get Professor Charles Senesi, one of the Deputy Minister One of Health, and they with me. And today we're going to talk about the travel portal for inbound passengers, but a number of other things as well we do generally for prepare against global disease them as well. The person who specifically in portfolio for prepare for public health emergencies in this country, na Professor Brigadier Fode Sir, we na the Executive Director for the National Public Health Agency. We insert as well, they are with we this afternoon. And with we as well, we get Doris Harding, we are the manager for the Public Health Laboratory that we get. We are the NPHA, we are the Public Health Agency as well, they run across the country. It tells you a lot about the capacity we also get as a country for see all the dignitaries there and then portfolio them as well, where they manage for keep we all safe. With we as well at the extreme left, I get Dr. James Squire, one of the Director of Disease Surveillance and Applied Epidemiology. And I start the conversation with Professor Charles Senesi. Professor, in the world, on a daily basis, different kind of disease and they meet different countries. And first will be everybody hantavirus in the US, where it affects the sheep. And then now there are talks about Ebola and DRC, but generally, we want to talk through general preparedness as a country and as a ministry as well.
Thank you very much, Mr. Moderator. Thank you for the introductory comments and questions. As a Minister of Health, we win at the custodian of the health of this country. We can always want to reassure the population, say, we have a plan for the healthcare delivery of Sierra Leone. And that plan is based on the life stage model from conceptual to senior citizen, where they look at all the factors that affect the people, including challenging times like even pandemics. And so as a country, we look at 4 key areas of healthcare delivery, even when pandemic strike or normal times. We get the primary healthcare, we account for almost 70 to 80% of our investment. We get the secondary and tertiary care, we are the hospitals there, secondary hospitals, tertiary hospitals like Conos, etc. Then we get the ambulances and the referral system, we don't really reform over the years, and also the outreach of mobile clinics. Last but not the least, we get the health security, where they respond to pandemics. And so we have a plan, whichever way we want to look at it. And for now, operationalize this plan, if we look at any components of the plan, let's say the health security, which is where we are today. There are 4 key areas where I'm sure the colleagues will delve into that. We get the infrastructural development for pandemic response. We get the human resource. We start getting medications, supplies, sanitizers, etc. Then we go with diagnostics. So we are well prepared, and each of them main entities they coordinate among themselves. So if we think about the infrastructure, we now have the Public Health Agency, which is well situated, and we get inside the Public Health Agency, it's all digitalized. They get a surveillance system where they feed it to the National Health Information Hub. As a ministry, we heavily digitalized. And then we get the personnel. We get well-trained personnel in the National Public Health Agency and in the Ministry of Health for ensuring whatever the Public Health Agency passes on to it, we're ready for response to that as a country. And then we'll get the supplies, the hand sanitizers, the oxygen, and other medical supplies, where the Pharmacy Board, the National Medical Supplies Agency is well situated for make sure they respond to support all the pandemic. And then we'll get the laboratory, the public health lab, where I'm sure Dr. Doris will talk about, and also the normal hospital labs. So as a country, we are well prepared for most of the pandemics. And even we learned a lot from the past pandemics, be it Ebola, COVID, so much so that even when other countries they had difficulties, when I talk about personnel, which Professor Sam will come in on it, like for instance, Rwanda a couple of months ago, they struggle with Marburg. Who that they call, they reach out to Sierra Leone. And we send together with the National Public Health Agency 20 of the best, which means we don't master survey the area of pandemic response in this part of the country and the region. And they're going to Rwanda and go settle the issues of Marburg and came back as heroes. So it's no wonder that even when this mpox will hit you again, we look at the science as a government, as an institution working closely with the public health agency, and we do the needful for put mpox under control. One of the best ways, the way even they compete for win, because some of the initiatives they were never done anywhere else in the world, but we able to look at the science and follow inside the science and take we then they could put pandemics under control. So having said that, we really have a plan for Sierra Leone. We can say that's why we're a federal country, or that learn from experience, to what we do for education, athletes of West Africa. We still work towards that legacy for make sure that every pandemic, even with Ebola now, that neither today we put everything in place as Professor Sam say, we make sure say people that will go to bed and be rest assured say we as a responsible government, because of His Excellency the President, only do the needful for protect the people of Masalo.
Thank you very much. And one of the things that we're really impressed by now, how much experience we also get. So much so that we even export that experience for help other countries. Notably, we experience in dealing with public health that we had to extend our help to Rwanda for fighting the Marburg. And I come to that particular experience, Professor Folisa, because how much of that experience they really give you the upper hand in preparing for public health emergencies now?
Thank you very much, Mr. Moderator. Yes, we don't go through an experience 2014 to 2016. We'll go through the Ebola at this country. So then we learned a lot from that. But for come straight to the current threat we get, about 9 days ago, where the WHO declared the current outbreak in DRC, Democratic Republic of Congo, as a public health emergency of international concern. As a country, as a ministry, as an agency, we put in place a lot of things for make sure say we will not repeat that kind of experience, we will not repeat the mistakes what we do in 2014, because the Ebola 2014 it been catching unawares. But one thing I want to allay the fears of Sierra Leoneans this afternoon is that currently, as I speak, we will not get any Ebola case in this country, we will not get any suspected case in this country, and we will not get any probable case in this country. So Sierra Leone currently is Ebola free, and the country itself, WHO class as low risk. That don't mean say we're not prepared. It didn't far away, but with the flights when they come into the country, Ethiopia Airlines, Kenya Airways, the one from a part of the continent. So we can put the acts in place. So take home is Sierra Leone is prepared. As I say again, we don't put a lot of things in place, and some of the things that we don't put in place, I will come to them. But I want the Sierra Leone people that know this particular strain we deal with a very rare. Currently, no the forum, no vaccine, not the forum. And as we deal with best practices, immediately WHO will announce this outbreak. We as a country, following, they will do an assessment of readiness. We're very transparent. People then will take them in various ways, because I see one thing we tell with partners yesterday say, if we look at the preparedness way, then announce this outbreak, we are 51% ready, because that time they yes or no answer, when they give that two, that is standard two. This day, no, we are not going, no, we are not going to airports, no, we are not going to border crossing points, no. But as I speak, so 9 days after, we don't make sure say we don't put most of them things in place. So do an explain today, definitely it will be far above 51%. So don't get down the right. So as a country, what we don't do? One, we get what we call heightened alert level. We don't increase the alert level to level 2. That is, we don't heighten with readiness. The National Emergency Health Committee, we don't activate them, we don't convene them, and then they actually advise government throughout this process. Even though we not get the cases, but still we activate the committee for advice government issues. What to do? Number 2, we don't enhance screening at all with entry points. When they do the assessment, now say do the assessment, don't be one, will not be done heighten up surveillance at them border points there, but now we don't heighten up. So in fact, looking international airports, the Gendema, the Balamoya, they're all fully operational with supplies and thermometers. 3, we don't pre-position emergency supplies and all then border crossing points for make sure say if something comes, if any suspected case comes, we will easily isolate them, actually contain them. Now if we don't deploy an ambulance, now looking international airports, the personnel in day 24/7, anybody come, they screen you. If you get suspicious, then pull you over. We don't establish an isolation center at Lungi Hospital, then 34 military hospital, and the primary admission center for now, where they deal with the military yonder. Then the 4th thing we don't do, we don't put the rapid response teams in all 16 districts on alert. All 16 districts get rapid response team. Through the district health management team, DMTs, we make sure say anything happen, then they will deploy immediately for to make sure say they see what they happen. 5th one is we don't activate with sub-regional cooperation, Liberia and Guinea, and also with our international partners, African CDC, ECOWAS. In fact, as they come now get one letter from ECOWAS that they ask we say they are confirmed if they can send huge number of thermometers for me so that we will just share about the entire country for make sure everybody vigilant. And the 5th one is the risk communication and community engagement. We don't heighten them. And 9 days ago it was not heightened, but now we don't activate all them processes that will make sure that we go into the system, go into the communities and actually educate people then. What do they ask for the public? Would they ask the public for trust with processes? Trust the country, trust the Ministry of Health. If you see any suspicious case, call 117. Call 117, they will take the appropriate action. So at the end of the day, before we go, I should say we will tell people that what you for do and what you not for do in case you see a case. Thank you very much.
Exactly. I want to just repeat some of the very, very important facts as well. Where Professor just read for we, which is very important for notes. Number 1, that we not get any Ebola in Salone. Number 2, we level of preparedness is level 2 right now. Screening, number 3 as well. Screening don't start now. All entry points them as well. That's the 3rd fact we should also take away. Emergency supply now available at the entry points them as well. In a case where we need for isolate as well. Isolation center don't set up now. Lungi 34 at the main hospital right now, when we'll deal with those cases and we'll get rapid response teams them now ready for move. Now all 16 districts are across. So now they bring me now to surveillance experts who we get on the panel, Dr. James Square. Doc, let me talk about surveillance because a very important point where Professor also mentioned that the collaboration with other countries that will share border with, Liberia and Guinea. What's now with surveillance capacity as at now?
Thank you, good afternoon. Yes, so surveillance, in the layman terms, now where you walk, now where you watch. So what we do basically now for make sure say we continue the communities and the data we get from our health facilities so that if we get any case we will be on time and then report on time. And we get surveillance officers then right up all the country, and even the community health workers and community volunteers then also they part of we with surveillance system. And so we surveillance in the sub-region, and even they don't take we here for those countries, and also even for even the guidelines so they take as an example, because we don't take the surveillance system very far from Ebola outbreak. Yes, so like I say, we get one of the best in the region, and the electronic surveillance system we get initially before the Ebola outbreak. Now we paper-based, but we don't move far away from that. And electronic surveillance, so even at the facility, we get over 1,600 health facilities in Sierra Leone. Each of those facilities, we give them tablets and a data bundle, support them with data bundles. As soon as they see any suspected case, they enter into the system, and immediately, and the system also generates SMS. So once they detect and they enter, all of we they get that SMS, so they know that this particular district, this particular health facility, don't report certain conditions. And also, like I mentioned, we also don't train community health workers. This now food soldiers that they in the communities for ensure say if they detect any of them with priority disease conditions, so they look for including Ebola, they report health facility. So that's how far we don't come with the surveillance system. And just for joining Professor Fedo's side, and the other ask we ask the communities is that event they start at the community. And this particular strain, they deal with in all this Sierra. So the most likely point we will get now through point of entries. So at times somebody will come, not manifest symptoms, but it could deal within the community. So we encourage the communities there. They know the signs and symptoms there, because it's the same signs and symptoms that Ebola will be get. If they see them from anybody absolutely, or anybody come, our community say you come from Uganda or there, so please let them make sure say the healthcare workers they know. We 117 line, when a free toll-free line it exists, it work. So we encourage the community members to really reach out to those lines and call immediately so that we'll be able to take appropriate response. Thank you.
Okay, and I come now to Madam Doris Harding, because in charge of the laboratory, and that is a very, very critical infrastructure to we response as a country, and even with preparedness. So, Madam Harding, back in 10 years ago, 15 years ago, when Ebola came to this country, one of the challenges we health system face now with laboratory infrastructure. As at today, how we did in terms of the level of preparedness, what we talk about to laboratory then?
Thank you very much, Jawad. As I can come in from the lab aspect, as you all know, the lab is the backbone to the health system in the country. If we not check what you do now, what you responsible for the sickness or the disease owner get, the doctor will treat una blindly. So when we think about the Ebola outbreak in 2012, Sierra Leone, we actually struggle to get the lab capacity. Now that make during that time we actually get delay in the response and diagnosis. As I talk now, we don't build the health system and strengthen from all the public health labs in terms of the COVID-19 outbreak and even the Mpox. This can even tell we say we get key laboratories when they well equipped, when they test for all kind of diseases, especially this Ebola. We get a well molecular diagnostics in place. We get a well infrastructure. Things are all in place. We get staff the way they're well trained. When I talk about molecular diagnosis, I talk about the PCR technique, that are the polymerase chain reaction. We also get gene experts there, where they deploy across in a point of care. We can take and go na the border, this is like Cambia. We take and go na Kailan. We take and go Gendema, then side and leave. Quick, we can just a cartridge. We collect the person sample and check them and wait to do the particular patient. So the lab is really ready. As I can tell you now, the lab is distributed across the country. We get Kenema, where they're the eastern parts. Now at the VHF lab, you go McKinney, we also get another lab where they test for any kind of diseases, all the priority diseases, including this Ebola what they talk about. You can't fit another get major of the labs. So we get CPHRL, that are the Center Public Health Reference Lab. Now at the hub for all the Center Public Health Reference Lab. That lab, we really get staff there, whether they do genomic sequencing and bioinformatic interpretations. When we get the first COVID-19 outbreak, the first variant, now Salonia, now we detect them. The Omicron variant, now Salonia, we detect them. So the lab is ever ready. We get a strong personnel then, well trained, we get the right equipment, we get reagents. As for this disease, what we talk about, this not new to we. Now it's part of a routine system. We always run the test for all the VHFs. If we get any suspected case for VHF, which includes Ebola, Marburg, Lassa, dengue, yellow fever, we always test them. So this is not new to we. So we are more than ready for tests. We are more than ready, also prepared for tests for any of them kind of diseases. And this one, even when they circulate around, as they talk, say there is no vaccine, there is no treatment for it. But if we get a suspected case of any of those kind of diseases, we test for Ebola. If you're positive, we can do sequencing and can tell you the type of strains where it is. It can either be Zaire, it can either be Sudan or Bujubuyo. So we are really ready. The lab is really more than ready. We get the right personnel. So thank you.
And maybe just one further question as well. Given that this is a new strain of Ebola, on the work with WHO or even a counterpart in a DRC for letting us understand the things they want to look for when finally we have to do tests if eventually we get to that point?
Yes, we need to talk with the counterparts of WHO, not only WHO, we also get other partners then. We'll always discuss with. In fact, some of them are even giving an equipment when I'm by the fire, where they test for 16 of those pathogens. Then, if the positive with the biofire, we get another reagent where they give it, where they confirm for tell me say this na Bujubu. We all that till the day he always is in place with all the partners who are in church with them. Thank you.
Mr. Minister, let me come to you because Professor Forisa gets boku other questions and we can answer. But every time we talk about public health emergency, we respond as well means we have to spend a lot of money, resource mobilization for different elements. And I know say NPHF for Cantona for that. Is this something right now would can tackle for put resources and the necessary side them as well, so there is no constraint when it comes to the response?
Thank you very much again. Yes, indeed, resources are needed in the healthcare system, especially in terms of pandemic, both human, material, and financial. But I'm very proud for the government, under His Excellency the President, we import the hit with. I can tell the public, say the first major fund of $1.7 million was given by the government of Sierra Leone, even before others can be put into the box. So we took that leadership for the one. And even as we talk now, of course, I oversee the public health agency and the political portfolio. Me and Professor Sa in the entirety, we work closely with the Minister of Finance for make sure say we reinforce certain resource system and make sure say if anything something happen, we government they jump on top of it. We able to put out the fire force, probably call others to come and join us. So indeed that leadership team very strong. And we thank the Minister of Finance, His Excellency the President, we thank the Vice President as well. Anytime we call to them, we go work hard and make sure say they allow with the resources we need for put the pandemic under control. I take the example of the latest import. We thank them very much for that.
All right. Professor Forisa, we don't talk all of this. What do we expect from the public? What should they do for support on our own efforts as well for prepare in case we have to respond at some point?
Thank you very much. The first thing I want to tell the public, now for me the public don't panic. Anything Ebola would experience or go through, people like easy to panic. And if panic coming, definitely we're bound for make mistake. So Lord, all no panic. Lord, we trust with institutions then, as all the speakers they don't say, we don't learn lesson, we don't develop systems, we don't develop the infrastructure, human capacity. So therefore this time around, I want the Sierra Leone people then trust the Ministry of Health and the National Public Health Agency. And the main thing then we get also things the way you for do as a citizen of this country. One, just avoid unnecessary travel, and then part of the country, and then part of the Africa. That one, simple thing. You know, they invite you for go church, because I understand some people they go some church program from other countries, they can isolate them. Avoid that. If you don't go that particular church meeting this time around at Uganda, you know go ahead, you know go die for that. So don't avoid unnecessary travel. Two, just avoid unnecessary contacts. Like how we do during the COVID, you know, wash your hands regularly. Then not spread unverified information. Misinformation, they destroy you. So just trust the information where they come from the dedicated sources from the Ministry of Information and Civic Education, the Ministry of Health, and the National Public Health Agency, who will always tell how to actually come out with any other channel of information, but trust the information. And the basic thing where they appeal to the Sierra Leoneans.
Let's talk about the travel portal now, because that is very, very important for people when they try to enter into the country. Tell me about how it work and waiting people who want to travel to Salone for do.
Thank you very much. As I say, we come here as a team. We get the possibility to develop the travel portal in-house at the National Public Health Agency. Michael Kamara there. They will come. I will pass the mic to her for they just tell me briefly, Mike.
Okay, wait, Mr. Mike. Okay, Mr. Mike. Okay, maybe just cancel so the camera will get to you. So just explain to me how it works.
Quickly.
And then
Sharp.
Yes, thank you very much. The travel portal is a digital tool we develop for travelers that really come in and as well as really go out of Sierra Leone. The purpose of them for do proper screening, health screening. So we capture information about the traveler, who side come out, who side go, which country they don't travel for the past 21 days. We also want to get record of that one day. Then also we most importantly take record of the health status. For example, if you don't get symptoms, then waiting at the symptoms, then we don't get, we also log them into the system. And once we do that one day, we do a proper screening as well within the point of entry point, then when, for example, the airport, and also we borders them. So once you get there, you need to fill the form, and the online form will be ready by the ending of this week, hopefully. We go for the live, and then you get some from a website, and as well as when you go to the airport, we get a banner where you just scan the QR code, then the URL will pop up, then you fill the form. Then we as well work as on the mobile version, where even if you did now the flight, you don't get internet, you can just fill them, then you save them offline. Then when you come down, within the border points, then we try to get free Wi-Fi, just like we travel go to any other country, you get free Wi-Fi, where you connect and push, and the registration where you don't do. Then from there, you go to the next point, which we hotel staff, then they screen you. You will get a thermal scanner as well. We will scan you as quickly as possible. Then we will get the, for know your temperature. Then after we don't do that one day, the hotel staff will check if not something we get minor things, the system they automatically advise the hotel staff then, because we, based on the points the way it is, for example, you say you get fever, you get weakness and the rest of it, the system, we don't do it together with epidemiology staff then, and know exactly what will be the cause. So that they will come to hotel staff then they will be able to tell you, say, oh, now something we need surveillance attention, then they can be able for escalate them to surveillance. The surveillance they can do further screening, and if not something very, very serious, the surveillance people can escalate again to the lab people for the testing. So it's a way of just tracking how people they come in and how they go out, and as well as doing proper screening, they will be able to know exactly how they go. Then we also get forget a dashboard where you get for me like an executive one, a good dinner with watch room as well for the National Public Health Agency, as well as the Ministry of Health National Data Hub. So you go there and you will see exactly what they happen and how the health status they and how prepared we be, not only for Ebola, for any other emergency public health diseases. So basically, that's not just a background of the travel portal and how it works.
All right. Quickly, just before you go, is this free? Just so clear, because back then during Ebola, I think everybody being need for tests, and there was a certain amount we need for pay. COVID, yes, there was a portal where there's a certain amount. This particular platform are free. And the second question as well, not just for the one way travel with flight or anywhere you travel from road, sea, or whatever.
Yes, for now it's free, completely free. You just need to go get the URL and complete them. Then and not only here, of course, when you fill the form, it will ask you which mode you travel, whether not air, whether not sea, or whether not land. And if you say not air, then you will see Freetown International Airport there, you choose that. If you say not land, you will see all the land points of entries there. If you say not sea, you will also see all the land points of entries there. So now so it's designed for now. Then it's definitely going to be free. For now, I don't know, probably this is something we, from the talk on the technical perspective, when I'm from the tech part, which is the ICT. But for now, I think Prof is here, Doris is here.
Definitely. Then we'll take the rest of the questions. Thank you very much, sir. All right, you can have this, sir. Prof, you get anything for add?
Yes. I just want to add to what Mike said. It is also helpful for trace somebody in case you can't do that flight stay, then somebody falls sick. So all the one that will be in contact with somebody near around who will actually trace you. Because if you on that flight stay, now you don't lodge, we know your address for actually trace you. So
all right. Technically, I mean, we don't get a detailed, very, very detailed explanation of preparedness across several layers, whether not surveillance, whether not with laboratory, whether not with contact tracing, resources, and even the technical know-how as well. So over to you guys. Questions? Let's see hands, and yeah, if we get questions online as well, we'll also take them. But let me see hands. Yes, Mr. Kamara there. Okay, we'll get 2. Sarah Sise, we'll get 3 here. Let's start with Mr. Kamara.
Mohammed Kamara, the watch. Professor, you can recall the first border case that Salon, then we discovered a small crossing point, not a major crossing point. What he would not done to create as a sanitation impact the community radio stations, either in terms of goods or otherwise. 2, Madam, we got an epidemic, endemic or pandemic. All the virus they will create they're different one way or the other. And so I'm going to do research. The laboratory in Freetown, you know these fertilizers are all in this them. Meaning that if there is a major case, they can rush the patient here. Tell me about the numerical strength of the medical personnel there, who are not trained for tackle various viruses there, since we first experience with Ebola.
Okay,
Can I go back to the third one, sir?
Okay, just yes, sir.
Minister, now you tell me about the storage capacity of the medication that we will get in case as a first. Tell me about the storage capacity of the medications we will get about the first case for Takulab, even though Professor said we will not really get a well-defined vaccine for tackle Ebola. Thank you.
All right, thank you very much. Let's go to Sarah Sise. Yes.
Professor, you say we don't prepare as a nation. How far una don't go for engage the herbalist there based on then situations there? Because people can use the crossing point where ABC, we get over 300 plus crossing points in this country. Taking you back. And you talk still on the preparedness. Una don't engage the drivers, them, and also the tricycle riders and the bike riders, and because where this starts, and also the school STEM, because the school STEM we get various comrades way that they travel in and out and they picking them quick for contact, then sickness there. How far on don they put wash facilities them at their school STEM based on the preparedness? Jawad, please, one question more. Taking a look at the basic infrastructures that we've been getting during the Ebola time in 2014. Kaiton and the likes. Now, una don't go back for restore them facilities and they back because of this Ebola we don't una don't dey and una don't dey prepared for.
All right, thank you very much. There's a gentleman. Yes, yeah, I think we'll get a question from Minted.
Yes, William SKB from NTTV. I just want to ask, to the ministers and also Professor. Now you talk of this particular disease there as a way, they try to protect. I want to know because we don't get the experience like where they travel, they use Guinea axis, they go find, from all the way to Guinea. Now, if you say you don't put things away for monitor, the main point that from Congo, Guinea, Kansai to your parts, side they will check you, then you ASEAN and do other stuff there. What about the bypass road? Because the bypass road I not ever like where they pass day because I can come out they go to other person or go watch at the Napamalap. I never see something like checkpoint whether they will check you for ASEAN or this, you understand. The only thing will just ask you for your clothes, your ID card and you don't after you come out, you understand. So I don't know how far I don't put things in place for us to check the bypass and not only for now but the entire Sierra Leone. Then also again, the sensitization, when we talk about this one now, like picking them, like community, people that will know they use internet. Since we still get people back where they never get touch, you understand? I get big people who get 40 years old, 30 years old, no get Android, don't live in the country past almost years. So how you go for, educating people and they see, now this and this we for do for self-best we protect ourselves. Thank you.
Okay, thank you very much. Let me see if we're able to take one more question. And yes, Tomato at the back.
Yeah, I'm glad to see from Choice FM. My question is, we've been experiencing these things once, and we see the way it damage people in this country. And from that, we don't get the experience of Anduba. Then suddenly we get engagement to different media houses. They talk to different people in different languages. How best, and I don't do this, for this particular one, we will not get a meet. For we engage in media houses them and engage them in different languages.
Okay, thank you very much. I think a few questions will we get online here. I think this now from Madam Doris in terms of the spread of we laboratories them across the country, if not each district gets or each region gets, so we don't no need for travel too long with the samples. And I think another question there as well, waiting at the turnaround time from the term one of the test to the term we results will come out. For in case we have to get to that point, then Madam, because I think you get then two questions and they online here, and then there is another question here for Dr. Squire on surveillance capacity. They talk about collaboration, cross-border collaboration to enable them. The way we prepare so we don't tire we if not so then self they treat them as well. Let know be say that we no more serious now and across the border. Then slack a bit. I think somebody they asked for that. But Mr. Minister, I'll start with you. Professor, I will come to you last because you get so many of the questions and for answer.
Thank you very much, Mr. Jawad. I think one of the questions was on the storage capacity of the medication. As I said before, we always get a plan. When you talk about medications, not only the medication, even the reagents, they get to be stored at a particular temperature. So, deliberately, as the ministry, we give renewable energy to almost all our health, all the tertiary hospitals in this country can get solar power now. And that speaks into also the storage capacities of these hospitals to make sure say, the medication and reagents are stored at the requisite temperature, let them maintain what we call the shelf life, the active ingredient will change for the other thing. So yes, and indeed, we also digitalize everything. Now we get a tool, we develop a salon called M-Supply. It monitor every tablet up to the last mile. So if you want to know if every hospital in this country, which are the storage capacity of the medication, everything is captured online. You touch one tablet, it gets registered there. And we make sure, see, also, even the warehouse, we are about to construct one of the biggest warehouse in this part of the world, and it's fully solarized, supported by the Global Fund in Kerrytown. So as a country, most of we in political position are highly technical also. I work on the regulatory agency in Switzerland. So you talk about storage, shelf life, and everything. We know exactly what it means. And we bring that knowledge back into the government with excellence they did. So indeed, yes, we have a good storage capacity, which we get an M-Supply dashboard as a Sidona, again on the tablet, again on the computer with a monitor. So we know to the last mile, almost tablet, almost reagent, almost hand sanitizers, almost things we need for adequate response to make sure that when they go near out of stock, it really alarm. It's real time. Now, so we really developed the Sierra Leone, the Pharmacy Board of Sierra Leone. We developed, other partners they come, we held an open discussion at the World Bank. Everybody presented their own supply chain management. Sierra Leone, the whole development was the best who we choose now. We did the support for spread right across the country. So indeed, we are better prepared than we were able to hit with. Thank you very much.
Thank you very much. And important as well for note that no time in we history had we healthcare system be so reliant and transformative with technology than now. And I mean, the Ministry of Health get a whole unit with a job number that for investing in technology, bring technological solution for track drugs, for improved systems, for improved efficiency across the healthcare system. So that's a very important point to note. Dr. Squire, I think you have some question regarding cross-border collaboration regarding surveillance.
Yes. The question is whether we can't have Yes, I want we found the 3 countries we suffer the 2015 Ebola. We all take this very seriously, and we all put preparedness measures in place. Just like what Professor Frederick said, we don't activate regional collaborations and communication with neighboring countries and of course in the region as well. And part of that, we get regular updates from Guinea and then Liberia. And I just want for Prof to also highlight more for touch us about the questions. Most of the questions have to risk communication, community engagement. And one of the things that I want to say, risk communication, community engagement is a process. We don't start, we don't activate all, we structure them when we get both at national and then at district levels. And we don't just do like 1 week since when we get the news. And this week, we did deep in and make sure say, like my brother asked, the first case will begin in 2014 at a small community border. Abideka around at that time. Yes, so what we do after the Ebola is that we create what we call community task forces. So all of those structures, we activate them all. I mean, because the community able for watch even pass through, they know who are the people when they come to the communities, they know who they go out. So those structures, we activate them all, and we make sure so we support them and continuously engage them. We just meet with Sludge, and somebody asks for the media houses. We just need to start the Independent Media Commission, and we will continue. In fact, last week we called the media houses and other stakeholders, the religious leaders, inter-religious council, the market women, the bike riders, the Okada riders. We called them all in the press and a meeting, and of course all of them commit to make sure that they spread news. And we don't do a lot of radio programs over the past 1 week, and I think that will continue to engage the media houses in different languages. We just don't finalize we IC materials into the different languages that we get, and I think that will be distributed, disseminated right down at the least community, so that everybody so far in Sierra Leone able for aware and make sure they become watchman. Because at this time, like we said, we don't get no case. The most likely way now somebody go count in the community. And so the community, very important. And we not just engage, we make sure we involve into everything absolutely what they do, so that they take the ownership and make sure Ebola don't come in the South. Thank you.
And I just want to also add to what Dr. Squire said and questions about public engagement. As a ministry as well, we work very closely with National Public Health Agency for put together a robust public education campaign. And this press conference is one of the starting points, and those engagements are also ongoing for rollout a mass campaign across the country as well. But let me come to you, Madam Doris. You get some questions about one, the turnaround time from when we test to when results will come out. Because we see in DRC that was a major issue, that it took long days for making them even know say this was Ebola in the first place. And then you have a second question from 818 line regarding how the laboratories are spread across the country. Every region gets, or every district gets, so just so understand that.
Yeah, thank you very much, Gerard. As I've been saying earlier, EVD testing or Ebola testing or VHF, it don't need to be. It's part of the routine system. So, as part of the priority disease, we have different turnaround times for specific diseases. Like for Ebola, it depends the number of samples. If we get like a 1 or 2, the turnaround time for that would be like a 6 to 12 hours. But if we start to receive a lot of samples, the turnaround time is 24 hours. In terms of the distribution of the public health labs, they are not found in the district. We get them like the regional labs. Like for Kenema like the regional lab, we get the Kenema VHF lab. It will serve for all the eastern province as well as parts of the northern province and southern province. You go to McKinney, we get the McKinney molecular lab. Instead closer, it will serve for the northern region. When you come down to Freetown, which is the greater part where we have so many populations there, we get about 4 labs where they're all ever ready for testing.
Okay,
thank you.
Thank you very much. Prof, you get a number of the questions then, so we'll end with you.
Thank you very much. Fortunately, the Honorable Minister and Dr. Square answered some. Media engagement, yes, now an ongoing process. We don't start and we don't do an isolation, as the moderator rightly said. We will very, very closely with the Minister of Information and Civic Education, or to get a risk communication and community engagement pillar within the NPH and the Ministry of Health. So all the work together and now a continuous process. We don't start them. Over parts now that will show that because it's 9 days, we do this declaration and we don't make sure so we don't reach almost all parts of the country. Then the other one, personnel trained after Ebola. Yes, a lot of training has been done. For give absolute numbers, no, but definitely the training done cut across all kinds of health workers, from laboratory scientists, where Madam Doris will talk about, epidemiologists, where they help with the surveillance aspect, hygienists, every aspect, doctors, medical doctors, we don't send people in Ghana for do advanced FETP training, we want to domesticate and now in fact now, Sierra Leone now, so that we will train more. Because that's more money we take for some people in Ghana, while not we use and go train more people in the country. So all these are the things that we do for actually expanding the human capacity of people that we train. And the DHMTs, now them own the response. Anything what they do, we actually that's the DHMTs for take the lead. All them people at DHMTs, like district health management team, they are all trained, and they do a continuous training, a continuous process. Even in quiet time, so to get it do. If I talk case study after some time, for local skills back, we go do to stimulation exercises. So they do, we don't know even across the border with Liberia, with Guinea, we don't do with Gambia. So that team will do continuous to make sure they all those skills. So it's a continuous process. And then the square, I don't talk about the engagement with herbalists. Yes, we have engaged the herbalists. We engaged them today. We don't engage the bike riders, market women last week. And then the restoration of facilities. We'll do it immediately. They announce we'll do a scope emission across the country. And we'll find out for say during the Ebola, they will make go to the holding centers at each of the hospitals. Some of them still okay, but some of them dilapidated. So we open now to make sure we'll make sure all the holding centers, the way they don't vandalize or whatever, will bring them to speed. So that they don't take a case from Kono and bring Aya. They don't take a case from Kabbalah, they bring Aya. So if it's like a 2-bed facility, that have to be ensured, working very close to the Ministry of Health, and they take the lead in case management of anything, any infectious disease can Ministry of Health, now they get the expertise. When they don't they provide advice and policy guidance on the issue. Then bypasses, yes. When the team go now, Jendema, Balamoya, the main crossing point there. But indeed, they got numerous porous places there. The team, Dr. Squire, people have found that they go on their side, and they find out for say a lot of crossing, they will call no screening at all. But they start engagement immediately with the people there, and the people that actually accept say, yes, more preposition people that live for start for screen. A porous, this is called over 40 to 60 porous entries there. So it's a process, we'll get there, for sure we'll get all together at the same time, it could be difficult. But we all therefore cooperate and make sure we work together. I think those are some of the issues that we.
All right. So, Mr. Minister, I will come to you for final words on we preparedness generally for deal with public health emergencies like this.
Yeah, thank you very much again, Sir Jawad. I think as a country, as a ministry supporting the public health agency, we were prepared. We really were prepared. And indeed, we get a very strong primary health care because pandemics begin and end in the communities. We can tell us with primary health care is very strong, especially at the district level and at the headquarters. Otherwise, most of them even for imports under control in shortest record time in this country because most of we said we come per camera, they move the office, go to NPH, me and Professor Sam will share the same office just to show you, yes, the future of pandemic response salon is bright. We train the one they back again from Ebola, about 1,000 or more of them, what they call the surge one now, we can stand by for such issues. And indeed from the imports again, we get more on train. So I think we're ready as a government and we're ready to work to give the NPHA the necessary resources where they need human, material and financial for make sure it's a commitment from His Excellency, say the health of Mama Salon and all my business. So we thank you very much and we're ready for support at any stage, anyhow, we'll make sure we take care of the health of the people of Mama Salon.
Maybe quickly, message to healthcare workers because they are the frontline responders to this.
Healthcare workers, we are motivated, we are fired up. We get the knowledge. In terms of specialties in this country, I consider I say, people will come here and go see the exam in Nigeria and Ghana in all the areas. Over the past 4 years, I stand on this as evidence, we get the highest pass rate, more than 80%, compared to even the Nigerians and Ghana when they say the exam. So we get the knowledge, we get the capability, so we don't equip them with the necessary material resources, the diagnostic, etc., etc. If we get a biomedical engineering unit now, where they repair some of the machines and where they break down. So as a country, we develop towards that excellence in healthcare system, what will become the essence of West Africa in healthcare system. Thank you.
All right, maybe one last question for Professor Folisa. Before you say final word, somebody asked if the portal don't go live now and then can begin for user immediately.
No, sir. Michael, talks by the end of this week, because we'll go validate that.
Okay.
Yeah,
Okay.
so we'll go validate that this week. Hopefully by the end of the week, I mean, it will be up and rolling.
All right. So your message to the public on waiting we for the waiting that we own responsibility as citizens.
The message I want to send to the people of Sierra Leone, Lord, we stop misinformation. Lord, make sure say we get the information right, and honor the media help for propaganda information. As we minister, they always say, we as an establishment, Ministry of Health and Public Health Agency, will make sure say we prevent the entry of any virus. But however, because we don't get control of all them porous border, they will not get control at the end of the day how some people sleeping. But if they're sleeping, if anything's sleeping, we will able to actually contain them in the shortest possible time.
All right. Thank you very much. A message of reassurance for everybody, every Sierra Leonean. Thank you very much, Professor Folisa, Executive Director for the National Public Health Agency. With me as well, also don't get Professor Charles Senesi, Deputy Minister of Health, one as well, and Doris Harding, we are the manager for the public health laboratories and what we get with the NPHA they run across the country. Dr. James Squire, Director for Disease Surveillance and Applied Epidemiology. Mina Mohammed Jawad, the Strategic Communications Advisor. We moderate today's press conference. We'll bring them to you live from the Miata Civic Center. Next week, we're not there because we are live in Pujam for the Civic Day series. We're in a part of the ongoing engagement with communities across this country for bringing governance to the people. But after that, definitely, we are back up and running. Until we meet again the other week, thank you very much for being here. Many thanks to the media partners and we carry we live on behalf of the Minister and the Ministry, one for telling our all Boku. Thank you.
Thank you.